Did you know that doctors can spot health problems just by noticing small hygiene habits in older adults? Things that seem normal or harmless, like skipping a step in your routine, can actually be signs that something deeper is going on inside. What's really concerning is that many seniors don't even realize they're making these mistakes. They do them every day, not knowing they could be putting their health at risk. In the next few minutes, I'll reveal the 7 personal hygiene mistakes that doctors immediately notice in their elderly patients and how fixing them could literally save your life or the life of someone you love. The information I'm about to share with you isn't taught in schools, rarely discussed in doctors' offices, and almost never mentioned in health magazines. Yet, it could be the difference between living your golden years in health or suffering from preventable conditions that rob you of your independence and dignity. Let me tell you about Harold, a 75-year-old retired engineer who thought his personal care routine was perfectly fine. Harold was active in his community, played golf twice a week, and never missed his grandchildren's baseball games. During what he thought was just a routine checkup, his doctor immediately spotted 3 critical hygiene mistakes that revealed Harold had been developing a serious condition for months without knowing it. "I had no idea," Harold later told me. "I thought I was taking good care of myself. If my doctor hadn't noticed these seemingly minor hygiene issues, I might not be here today to tell my story." Today, I'll share exactly what those mistakes were so you can avoid Harold's frightening experience. But more importantly, I'll tell you precisely what to do instead. Simple changes that could add years to your life. Starting today. Mistake 1. Neglecting oral hygiene. When was the last time you really looked at your toothbrush? Is it frayed and worn out? Are you brushing thoroughly twice a day? And here's the more important question. Did you know that poor dental care isn't just about bad breath or tooth loss? It's directly linked to heart disease, stroke, and even dementia. Geriatric specialists at Harvard Medical School have proven that bacteria from untreated gum disease can enter your bloodstream and cause life-threatening heart conditions. In fact, their research shows that seniors with poor oral hygiene are 3 times more likely to develop cardiovascular problems than those who maintain proper dental care. But don't just take my word for it. Let me tell you about Sylvia, a 68-year-old retired school teacher from Oregon. Sylvia ignored her bleeding gums for months, thinking it was normal at her age. "I just figured that's what happens when you get older," she said. But during a routine physical, her cardiologist discovered dangerous inflammation in her heart valves, directly caused by oral bacteria that had traveled through her bloodstream. The doctor told her that had she waited just a few more months, the damage might have been irreversible. What should you do right now? First, examine your toothbrush. If it's more than 3 months old or showing any signs of wear, replace it immediately. Ideally, switch to an electric toothbrush, which removes 62% more plaque than manual brushing, according to studies at the University of Pennsylvania Dental School. Brush twice daily for a full 2 minutes each time. Set a timer if you need to. Floss every single night without exception. And never skip your dental checkups, even if you have dentures. Have you noticed any bleeding when you brush? Any swelling in your gums? These aren't normal signs of aging. They're warning signals your body is sending you. Don't ignore them. For another day. Mistake 2. Infrequent bathing and skin care. How often are you bathing? Be honest with yourself. Many seniors reduce their bathing frequency as they age. But did you know your skin is your largest organ, and changes in its condition can reveal serious internal problems before other symptoms appear? Dermatologists from the Mayo Clinic warn that reduced bathing frequency in seniors often masks early signs of diabetes, liver problems, and cardiac issues. Their clinical studies reveal that nearly 40% of undiagnosed medical conditions in elderly patients could have been caught earlier through proper skin observation. Consider what happened to Clarence, a 77-year-old retired postal worker from Michigan. Clarence thought bathing once a week was sufficient. especially during winter months when his skin felt dry. I didn't want to dry out my skin, he explained, but when his physician noted unusual skin discoloration during an appointment, for an unrelated matter, further testing revealed early-stage kidney disease. The discoloration wasn't due to poor hygiene itself. Rather, the infrequent bathing had hidden a critical symptom that could have been spotted weeks earlier. What's the solution? Establish a regular bathing schedule, at least 3 times, weekly, even if you're not particularly active. Use mild, fragrance-free soap that won't strip your skin's natural oils. After bathing, apply moisturizer while your skin is still slightly damp to lock in hydration. And most importantly, regularly examine your skin for unusual changes in color, texture, or sensation. Are you noticing dry, flaky patches, unusual discoloration, areas that itch persistently? These could be your body's way of alerting you to something much more serious happening internally. Don't wait another day to address these warning signs. Mistake 3. Ignoring nail care. Take a moment right now to look at your fingernails and toenails. What do you see? Are they neatly trimmed? Clean underneath, free from discoloration. The condition of your nails is a window to your overall health, something doctors check immediately when evaluating elderly patients. According to the American Academy of Dermatology, nail changes can indicate over 20 different systemic diseases, from anemia to thyroid issues to heart disease. Their research shows that in patients over 65, nail abnormalities led to the diagnosis of previously undetected internal conditions in nearly 30% of cases. Let me share Beatrice's story. At 82, Beatrice didn't think her thickening, yellowing toenails were concerning. She simply stopped wearing sandals and hid them in closed shoes. I figured it was just part of getting older, she told me. But when she finally saw a podiatrist for foot pain, the doctor immediately diagnosed a fungal infection that had been allowed to flourish for so long, it revealed her severely suppressed immune system. Further testing uncovered a serious underlying condition that required immediate treatment. What should you do today? Trim your nails regularly, straight across with slightly rounded edges to prevent ingrown nails. Keep them clean and dry. Wear breathable footwear and change your socks daily. And never ignore changes in nail color, texture, or thickness. These aren't cosmetic issues, they're potential warning signals from your body. Are your nails brittle, discolored, thickened? These changes aren't inevitable parts of aging. They're your body trying to tell you something important. Will you listen before it's too late? Mistake 4. Improper incontinence management. This is perhaps the most shocking hygiene mistake because of how common it is and how desperately people try to hide it. Over 50% of seniors are silently dealing with some form of incontinence. But the truly shocking part is how many hide it instead of seeking proper treatment. Urologists from Johns Hopkins Medicine report that untreated incontinence leads to dangerous skin infections, falls, social isolation, and can mask serious conditions, like bladder or prostate cancer. Their studies reveal that seniors who properly manage incontinence issues have 60% fewer complications than those who attempt to hide the problem. Take Douglas, a 73-year-old retired accountant from Arizona. Douglas was too embarrassed to mention his occasional leakage to his doctor. He used paper towels and changed his clothes frequently, thinking he was managing the problem. When he finally sought help after developing painful sores, doctors discovered an advanced prostate condition that could have been treated months earlier, with much better outcomes. "My pride nearly cost me my life," Douglas admitted. "I wish I had talked to my doctor at the first sign of a problem, instead of trying to hide it." What should you do? If you're experiencing any form of incontinence, first, never be embarrassed to discuss bladder issues with your doctor. They see this every single day. Use proper absorbent products designed specifically for incontinence, rather than makeshift solutions. Change promptly when wet, and follow a proper cleansing routine to prevent skin breakdown. Most importantly, recognize that incontinence is not a normal part of aging. It's often a symptom that something needs medical attention. Are you experiencing occasional leakage? Finding yourself planning outings around bathroom availability? Using makeshift protection? Don't wait another day to speak with your doctor about these symptoms. Your health and possibly your life may depend on it. Mistake 5. Ear hygiene errors. What's your ear cleaning routine? Be honest with yourself. Are you using cotton swabs, inserting them deep into your ear canal? If so, you're making a dangerous mistake that many seniors make every day. Many older adults are damaging their hearing and missing signs of serious infection due to improper ear cleaning. Otolaryngologists warn that improper ear cleaning is responsible for nearly 40% of ear canal injuries in patients over 65, with many cases leading to infections that could have been avoided entirely. Let me tell you about Patricia, a 71-year-old retired librarian from Washington. Patricia regularly used cotton swabs to clean deep inside her ears until she punctured her eardrum, leading to a severe infection that spread to nearby tissue. "I had always cleaned my ears this way," she explained. "No one ever told me. It was dangerous." Patricia required emergency treatment and suffered permanent hearing damage that could have been completely avoided. What's the correct approach to ear hygiene? Remember this simple rule. Never insert anything smaller than your elbow into your ear canal. Clean only the outer ear with a warm, damp washcloth. If you feel you have excess wax, use eardrops specifically designed to soften wax, following the package directions precisely, and see a doctor immediately if you experience pain, discharge, or hearing changes. Are your ears itchy, feeling full, or blocked? Experiencing unexplained hearing changes? Don't attempt to resolve these problems yourself. They require professional medical attention. Your hearing is precious. Protect it with proper care. Mistake 6. Poor foot hygiene. When was the last time you really looked at your feet? Not just a passing glance, but a thorough inspection of every part, between the toes, the heels, the soles. Your feet contain vital clues about your circulatory and nervous systems, clues that doctors check first in elderly patients. Podiatrists specializing in geriatric care at the American Podiatric Medical Association state that foot hygiene issues often reveal the first signs of diabetes, neuropathy, and vascular disease. Their studies show that in patients over 65, proper foot care and regular inspection could prevent up to 85% of diabetes-related amputations. That's not a typo. 85% of amputations could be prevented with proper foot care. Consider Raymond, a 76-year-old retired factory worker from Illinois. Raymond ignored the dryness and minor cuts on his feet, assuming they were just normal signs of aging. "My feet had been looking rough for years," he admitted. But when his doctor noticed them during a routine exam, he immediately ordered diabetes testing, catching the disease in its early stages, when lifestyle changes could still make a significant difference. "If my doctor hadn't checked my feet, I might have gone years without knowing I had diabetes," Raymond told me. "By then, the damage would have been severe." What should you do starting today? Wash and thoroughly dry your feet daily, especially between the toes, where fungus loves to grow. Inspect them regularly for cuts, sores, or changes in color or temperature. Wear clean, dry socks made of natural fibers or moisture-wicking materials. Apply moisturizer to dry areas, but not between the toes, and never ignore pain, numbness, or wounds that don't heal. See a medical professional immediately. Are your feet dry and cracked? Have you noticed any cuts that aren't healing properly? Any unusual discoloration or loss of feeling? These aren't just cosmetic issues. They could be early warning signs of serious conditions that need immediate attention. Mistake 7. Medication-related hygiene issues. Are you taking multiple medications? Have you noticed changes in your body odor, sweating patterns, or mouth dryness since starting them? The medications keeping you alive might be causing hygiene problems that signal dangerous side effects. Pharmacologists at the American Geriatrics Society have documented how certain commonly prescribed medications cause dry mouth, excessive sweating, or body odor changes that indicate potential toxicity. Their research shows that nearly 40% of adverse drug reactions in seniors present first as changes in personal hygiene needs, before more serious symptoms appear. Take Barbara, a 67-year-old retired nurse from Florida. Barbara's unusual body odor was dismissed by her family as poor hygiene until her geriatrician recognized it as a sign of medication toxicity that was slowly damaging her liver. "I was showering regularly and using deodorant," Barbara explained. "I had no idea the smell was coming from inside my body, not from lack of cleanliness." What can you do to protect yourself? Track all hygiene changes after starting new medications. Keep a simple journal noting any differences in body odor, sweating, mouth dryness, or skin changes. Stay properly hydrated unless otherwise instructed by your doctor. Report unusual sweating or odor changes to your doctor immediately, as these could indicate dangerous drug interactions. And never adjust dosages without medical supervision, even if you think the medication is causing hygiene issues. Have you noticed unusual body odor despite regular bathing? Excessive sweating? Extreme mouth dryness? Don't attribute these changes to normal aging. They could be warning you of potentially life-threatening medication effects that need immediate attention. Now you know the 7 critical hygiene mistakes that doctors immediately notice in their elderly patients, and exactly how to correct them. By addressing these issues today, you can prevent serious health problems, maintain your dignity and independence, and potentially add years to your life. Remember, proper hygiene isn't just about appearance or social courtesy. It's a vital part of maintaining your health as you age, and these simple changes could literally save your life. If you found this information valuable, please hit the like button right now. Has your doctor ever noticed any of these hygiene issues during your visits? Share your experience in the comments below. Don't forget to subscribe and hit the notification bell to receive more potentially life-saving health information like this, and please share this video with your loved ones who are over 60. This knowledge could literally save their lives.